has come a very far way. Over the last 25 years to today, Diwali is celebrated in such great pomp, not only by our Hindus, but by the whole Canadian diaspora. Even in Parliament Hill, the Prime Minister celebrates Diwali, and so it's a very, very, very great thing for all of us as Hindus to be proud of this very great day. Om Sahana Vavatu Sahano Bhunaktu Sahaviryam Karavavahai Tejasvinapaditamasttu ma vidvishavahai. Om Shanti Shanti Shanti. May the Divine Mother inspire you, bless you, and as you see the lights flickering today, please light the light of hope, light the light of healing in someone else's heart, and this is the meaning of Diwali.
We've always supported any good cause in the community, and we felt that it was extremely important for the South Asian community in terms of healthcare. So wholeheartedly, ATN has supported Trillium.
Well, we want to thank you very, very much for being our media sponsor here this evening. I hope you and your wife, Jaya, have had a fabulous time with your guests that have joined you here this evening. We thank you very much once again. Ladies and gentlemen, Shan Chandrasekhar and Jaya Chandrasekhar here tonight from ATN as our media sponsors.
I know you're having a lot of fun, but we need to take a short break, so don't go away. We'll be right back. Welcome ATN viewers. We're gathered here at the Pearson Convention Center right here, right now, and we are all here for one of the biggest events of 2012. As you all know that in Indian calendar, the Festival of Lights, Diwali, has been really celebrated. So we are here to gather and be here part of Trillium Diwali. So let's take a look.
This is an outstanding celebration in our Festival of Lights, and it represents so much of the goodness in all of us in our community. I have the distinct honor of being the CEO and president of our newly merged hospital, the Credit Valley Hospital Trillium Health Center. And I can tell you that our South Asian community has been such an outstanding supporter for us as we have worked through the last year. We'll be coming up to our first anniversary. We've served over 1.5 million patients this past year. 22,000 of those have benefited from the services in our endoscopy suites. 22,000 people. Without your help, that wouldn't happen. But we want to look to the future because we know we have a growing community, a vibrant community, and one that needs us when they're at their most vulnerable, needing healthcare services. And so, although we have a newly merged hospital, one thing hasn't changed, and that is our commitment to patients, the families that support them, and their friends. And so I want to thank each and every one of you for being here tonight. I want to pay tribute to our foundation that invests in us each and every day so that we can deliver the best possible health care right here, close to home, in our community. Thank you very much.
As you've just heard, now that we've merged, Michelle is leading one of the largest hospitals in our province and doing an incredible and tireless job at that. And I think that's worth another big round of applause from this audience. Thank you. And thank you to all of you for joining us this evening as we celebrate 11 years of Diwali. Now, when it comes down to it, what we're really celebrating tonight is the incredible impact that we can all have when communities come together and the hospital in support of better health care in our community. 11 years ago, the South Asian community came forward to the foundation with a proposal, and that was to host a Trillium Diwali fundraiser in celebration of the annual Festival of Lights. And so we have Trillium Diwali. We started with 600 guests in our first Diwali. Tonight we have over 1,000 supporters joining us this evening. Together, we have raised over $5 million in support of priority needs at our hospital. And many milestones, including the naming of our Om Fracture Clinic. Just look around this room. Each and every one of you are our heroes. Through your support of Trillium Diwali, you're ensuring that the state-of-the-art health care continues to be available for us and our loved ones for many years to come. Your support not only benefits patients, it also shows that it's an important symbol to our team, the medical team, nurses, staff, the entire team, about how you value the health care that we provide. Our healthcare heroes are indeed grateful for your vote of confidence. Your participation this year and over the last 2 years is supporting the endoscopy suites, as Michelle mentioned, and you'll hear shortly from Jennifer, a grateful patient, just how important endoscopy is for the detection and treatment of some highly complex conditions that affect so many in our community. Now, I'd like to recognize and have your attention the outstanding dedication and hard work of our Diwali fundraising committee, foundation staff, and all the volunteers that make this event so successful. In particular, our co-chairs. A big round of applause for Rupi Tandon and Dr. Milan Patel. Thank you for your tireless work and dedication. So on behalf of the foundation, special thanks to you for your outstanding and generous support. It's heroes like you that help us transform healthcare right here in our community. Thank you for giving 110%. Have a great evening and a very happy Diwali to you and your loved ones.
We have a fantastic entertainment group that is here. They've had an opportunity to perform for Her Majesty, Queen Elizabeth, and of course, they've had a chance to be in a bunch of Bollywood films and with personalities. Ladies and gentlemen, put your hands together in a warm welcome for the one and only DK Bollywood Dance Pack.
An event of this magnitude takes an enormous amount of effort and teamwork. We would like to acknowledge the Trillium Diwali Committee, who have worked very hard to plan a fantastic program for us to enjoy tonight. I will now take a moment to honor the Trillium Endoscopy team. This outstanding group works very hard each and every day to diagnose, treat, heal, and comfort our patients. They are true heroes.
Whether you're a participant, sponsor, prize or auction donor, your generosity has a tremendous impact in our community and it's truly appreciated. Please enjoy the rest of your evening and happy Diwali.
My life in Canada started about 44 years ago, before any of these hospitals came up, and I'm so glad that they are so much part of the community and a lot of research is being done, and it's a wonderful sets of doctors who are doing tremendous service, not only the South Asian community but the community at large. We want to thank all of them, and we are ready as a community to help them to reach their goals of best health care in the world.
Back in 2008, I wasn't feeling like my usual self, and I'll admit, I've never been one to put my health first. When I first started losing large amount of weights, I figured it was just due to stress and that would pass, so I ignored my symptoms. As time went by, I kept losing more weight. Over a period of 6 months, I lost 70 pounds. I had difficulty keeping food down, and I was extremely tired. It reached a point where I no longer had control of my body, and I couldn't walk unaided more than 10 steps. One day while I was at work, I fainted and bumped my head on the side of my desk. That's when it truly hit me that I had to do something. Dr. Newman performed an emergency stomach scope and colonoscopy, and before I knew it, I got my answer. I had Crohn's disease. I truly believe that diagnosis was life-saving for me. Ever since my diagnosis, I've had 4 colonoscopies. I was at the hospital just 2 weeks ago having one. Every time I go to Trillium, I'm always treated with such kindness. The doctors and staff are so compassionate and comforting. It really makes me feel thankful as a patient to be cared for by such an outstanding healthcare team. If I had one message to share with you tonight, it would be this: don't wait, put your health first. After the experience I had at Trillium, I realized more and more how important it is for our experts at our hospital to have the advanced tools and state-of-the-art equipment that they need. This is made possible through community support, and it shows. The heroes at the hospital, we believe in the work that they do. My eyes have definitely been opened to how much of a difference the community can make. And it's so true when they say every gift counts. I want to say how thankful I am here for the Trillium team, including Dr. Jamie Newman. I'm here today because I went to Trillium, and I feel immensely grateful for the care I received. Thank you, and enjoy the rest of your evening. Thank you, everyone.
It's been a remarkable journey. We started small, but now it's gone so big. It's now a mainstream event. The event continues to get popular every year. It's now on an autopilot. We don't have to advertise, and we are very, very pleased the contribution that the Indian community is making towards Trillium Hospital. In fact, for your information, the fracture clinic has now been named Om Fracture Clinic.
If you are not here, you're missing a great event. Don't miss it next year. We'll have a repeat performance next year. Do come, and if you cannot make it, make a donation. Make a donation in the spirit of Diwali. And go to our website, trilliumdiwali.ca, and make a donation.
Well said, Rupi. And I would say just a big special thank you to all the volunteers, Rupi and Milan Patel, who've done so much to support this event. Thank you. And thank you to the South Asian community for rallying behind the work we do at Trillium.
हो गया गणपत बजाना काय को बंद किया?
As you know, the Trillium Diwali has been a fundraising event for this year, 2012. I hope you all enjoyed the fundraising and the entertainment that we provided you. We will come back next time. Till then, goodbye.